to our discussion about the best pain resources for patients and their loved ones, and how really to be able to punch pain in the face, get back to leading the life that you deserve, and know the options that are out there for help. If we haven't met, I'm Dr. Orlando Landrum, the founder of Cutting Edge Integrative Pain Centers, who really looks to be able to help patients understand what are some of the treatments that are out there for your improvement and how you can be able to understand what those options are. So, one of the things that we're going to talk about today is various different online resources that you can be able to find that will help you be able to understand what really is going to give you benefit and how you can be able to use those resources in order to make informed decisions about how to be able to treat your pain. So, what we're going to talk about in just a few seconds, as it's trying to get a sneak preview for you guys a little too soon, is to give you some understanding about different options that are out there that can help you be able to figure out how to get better, how to feel better, and how to do that in an informed, educated way so that you really do have the best possible understanding of treatments that can really give you the best way of getting back on your feet the way that you'd like. So, right off the bat, we're going to talk a little bit about those different things that can help you get some understanding without you having to be a Dr. Google uh, disciple, right? So if you ever go to your physician and you say, hey, I found this in Google, most of the time we're like, oh my God, here we go with the Google piece. Because many times finding unverified, unvalidated information on different websites via Google just doesn't always work. So, what we want to do is give you something that's more substantive, more valuable that you can be able to look to and say, yep, this is going to be an option that's going to help me get to where I want to be. So, starting off right off the bat, one of the things that we're going to do is we're going to get you in contact with one of the best sites with really figuring that out. And it's probably one of the best sites for not only patients, but also for physicians. And that is a site that's called Pubmed. So when you talk about Pubmed, it's basically an option that allows for you to be able to look straight up for your question, and it's going to give you a research element that's going to give you some understanding right off the bat. So if we're taking a look at this, you can be able to see it gives you from NIH, the National Library of Medicine, a way to be able to enter a query directly into the field. So if you're looking for this, and this is what you need to see is pubmed.ncbi.nlm.nih.gov. If people are actually interested in this, by all means, let me know the different sites that you're open to, and we will leave them in a link on our YouTube channel for you to be able to follow along and look up various different elements. So, why might this be of value? The reason a site like this might be of value is if you have pain like from Ehlers-Danlos syndrome, or you hear your doctor say something like cervical radiculopathy at C5-6 that's caused by disc herniation. Now you have a way to be able to look at some different treatments, potentially other than just steroid injections and surgery. So being able to access this gives you what many physicians and many people in the healthcare field look at with regularity of saying, how can I understand what is the current research? What is the current true scientific underpinnings? Are there things like meta-analysis where you take and you pull data that looks at different research studies and then we compare them to see what's been most accurate? This is one of the starting points that is incredibly helpful. The challenge is sometimes interpreting it. But on this channel, it's one of the things that we endeavor to do. So for those of you who come up with different contexts of pain and regenerative medicine and really want an understanding of different papers, by all means, submit it to us and it'll be a topic that we'll cover. So the second item that we want to cover is something like this, and that is talking about regenerative medicine. And normally, when we discuss regenerative medicine, there's a discrepancy in understanding, meaning there's a difference between what the doc and nurses and other healthcare providers might understand and what patients may understand with the aspect of regenerative medicine. And so, one of the reasons why we're going towards regen right off the bat is to really have an understanding of, is there a way to be able to treat this problem as opposed to only mask it? And that's really where I believe regenerative medicine has a huge niche to fill. Do we think that it fills every option? No, of course it doesn't. But are there certain things that it can do that many people just really don't have an understanding of? Sure. And that's everything from spine to joint to actually various different arthritides. So things like rheumatologic arthritis, things that we didn't think could previously be treated by utilization of a discrete treatment option at a joint. Now there is premise that maybe it's broader and it's greater than that. So one of the ways to be able to have an understanding of that is for you to educate yourself. As a physician, I feel like our role is to be not just the person that helps heal you, but also teaches you. But at the same time, you want to be able to take control of this and have an understanding for yourself. And so, this site that's actually put on by Mayo Clinic, which many people have obviously heard of, helps actually patients understand that. So, if we were to expand this out and take a look, one of the things that we can see is that it goes into different modules that explains what regenerative medicine happens to be. So, let's see if it'll pull up for us and it'll cooperate. And all of this is free. We're not giving you options that are looking at treatment options that are, you have to pay $500, $600 for a Coursera module or something along those lines, but something that really is going to be able to give you an option that's going to help you be able to understand exactly what are stem cells, what is PRP. Okay, so as you can kind of see, it's very basic, but basic is good. Those are things that we really want, is to understand how things tick and how we can be able to wrap our arms around it so that we can be able to say, yeah, I get this. This is going to help me be able to kind of use our catchphrase, how do you punch pain in the face and get back to leading the life that you deserve? And so being able to use Mayo as a resource for understanding regenerative medicine is one of the things that we feel like is a huge element of being able to really get a gist of what's going on, how to understand it, and how is it potentially applicable to you and the problems that you have. One of the other elements that's out there is one of the entities that we rely on almost exclusively, and that is Regenexx. So, as those of you who have followed our blog, our website, our YouTube channel, you know that we have an affinity for Regenexx. We are a Regenexx clinic. And one of the things that we really want patients to understand is their outcome data, which is one of the things that really differentiates patients from, and this particular use of regenerative medicine from other entities, because the aspect of outcome data basically means, can you look at a problem, i.e., something like, let's say you have a knee problem, and then say, you know what? I want to understand, if I have a certain amount of function, how, if I got treated with different types of regenerative therapies, how much does it improve and over what period of time? And those things are unique and not really all that common for many people to have an understanding about. So if you can be able to get that assessment and know it for a fact, it's one of the things that is most differentiating for a website such as regenerative medicine, like Regenexx, from one site compared to another. So to be able to look at something like this, where you can say, you know what, I can understand my problem, my issue, and how to be able to address it, is one of the unique elements that Regenexx really is able to bring to the table. The next site that we're going to talk about is a site that is actually really well versed and is quite um, productive with having a specific niche for pain patients. and that is the elements of the U.S. Pain Foundation. So when we take a look at the U.S. Pain Foundation, it really has been a resource for patients for years, where it not only provides programs and services, it touches on what is the current topics that are of interest in patients dealing with chronic pain, and it understands the 50 million Americans that are in pain every day. It talks about different treatments, it talks about causes and diagnoses, it talks about self management, it gives explanations about complementary therapies. So, all of those are things that really being able to tie into the US Pain Foundation is a huge resource for individuals getting an understanding about how to be able to know what options are out there, how to improve those options, and how to be able to weigh risk and mitigate that based off of what you understand those different treatment options are and how they could potentially apply to you. So one of the other sites that we really rely heavily on for a number of different reasons, but most painstakingly is because of the connection to my own background, is the aspect of Harvard Health and what they produce specifically within the context of pain. And they have a number of different articles that are out there, from bursitis to foot pain to painkillers, and really being able to tap into this. It's pretty much always validated with forms of literature that you can be able to find in that PubMed reference that I mentioned earlier, that allows for you to be able to say, I got it, I get it, and this is how I want to be able to figure out how to be able to improve um, myself by knowing that what I'm reading is truly genuine. It has legitimacy, and that I'm not just reading something that some person looked up for 15 minutes and now I'm trying to base my treatment options and how I'm going to talk to my healthcare providers about what is going to be the next best step for me. One of the other options that actually it presents some interesting articles, mainly for physicians, but it can be pretty darn useful for patients, is the elements of something that's called practical pain management. So when we take a look at practical pain management, or PPM, it's a journal that is written in both print as well as electronic media. So this journal, PPM, is a journal that really provides a lot of different resources on conditions. It provides resources on things like carpal tunnel, complex regional pain syndrome, diabetic neuropathy, and so on. And it's one of the few journals that's out there that really gives a pretty easy to understandable, digestible way of knowing what options are out there for you to be able to figure out how to be able to then utilize that understanding to end up being able to improve your overall pain condition and how to be able to feel better. So one of the other articles that's similar to this, but traditionally has a little bit more of a physician focus, is that of something that's called Pain Medicine News. It's a journal that really gives understanding and about newer technology. So one of the topics that are questions that has just come through is, are you going to list the name of these websites and blogs? So for those of you who are joining us, one of the things that I said earlier on, but I definitely want to make sure that I say repeatedly, is so this video will be kept for evergreen content, meaning it will be saved indefinitely on our YouTube channel, and we'll have a listing of all the various different websites and blogs and YouTube channels that we're going to reference. So that way you can be able to look this up at a later date, and you don't have to try to remember all this or furiously write down all the different things that we have in place. So Pain Medicine News gives a whole host of understanding and treatments that are out there. And it will talk about everything from neuromodulation, like spinal cord stimulation or regenerative medicine, to things like what is the cause of different headaches, how are different pain protocols more effective for certain treatment options, uh, things along those lines that can really give you some understanding about why one might be having a certain problem versus another, and how that can be able to lead towards improvement and what you can be able to do to kind of know some of the newer cutting edge type treatments that are out there. Okay. So, one of the other treatments that are out there in order to be able to kind of understand, or rather resources, and we actually had the original founder and editor for it come onto our site, so you can reference it in one of our previous videos, and that is the Alternative Pain Treatment Directory. And so, what this gives is various different providers, of which our Cutting Edge Pain Clinic happens to be one of them, but different providers that do alternative treatment therapies. And so, they're going to be things like acupuncture or aromatherapy or things of that nature that you can then be able to figure out, are there other ways that we can look at an integrative medicine blend about how to be able to do different techniques that may be more naturopathic in nature, but also has a substantive backed resourced element that has looked at different results for an extended period of time. So one of the other things that we have out there is the context of physical therapy, and the Manual Therapist has a phenomenal blog that really looks at different types of therapeutic options, traditionally from the physical therapist viewpoint, but in particular, it gives an understanding about who's a rapid responder for therapy, why you might consider different types of treatments, and things that you otherwise might not normally ask your therapist. But what's McKinsey method? What's Graston therapy? How are different treatment mobility exercises that I can do at home may be more useful? What is the elements of femoral acetabular impingement syndrome, and what are some therapies I can do to try to improve that? So all those type of things are hugely useful in understanding different treatments that may be of value. So if you have an orthopedic condition, many people struggle with trying to figure out, you know, I think I have a joint problem. I think it might be my hip, but maybe it's my knee, or maybe it's something that's called bursitis, but I'm not quite sure what exactly does that mean. Or one of the best resources for understanding orthopedic conditions is the site that I'm going to give to you in just a second. And it was actually founded by orthopedic doctors with the intent to be able to educate patients. So that site is the following. It is OrthoInfo. And so you can be able to find different parts of your body parts, click on it, and get understandings about what this means, what it entails, how it might be of value, what exactly you can be able to learn from being able to get this element of understanding what is the disease, what's the condition, how is it impactful, and exactly what does that mean for me. For instance, if you have something like scoliosis, exactly what the heck is scoliosis? Or if we were really looking into this, what is stenosis? How do these different things exist? What exactly does that mean? Are there differences in different types of treatment? How can we understand what those treatment options are? And what can we do to be able to make sure that this is going to be a good fit for you? And then we have a number of different YouTube options that are out there that are pretty useful with having an understanding about what is a value, how there might be utility in understanding that, and what can really be valuable. So one of the best resources that is out there for, particularly for different types of pain and exercises that you can try, is Ask Dr. Joe. Now, she's a doctor of physical therapist, not an MD. However, she has really entertaining videos that really provide different treatment relief options. For instance, shoulder pain, muscle knot relief, upper back pain, back pain relief stretches and different things along these lines that a number of my patients have let me know that this has been something that has been useful for them. And so hence we've decided to say, hey, you know what, let's review that channel. Let's see what's actually being offered. And can we be able to provide some insight into how would we best utilize that for patients' potential betterment and how they could then be able to apply this for an option that's going to be useful for them. If you're finding value to this, and particularly if you're on our YouTube channel, please hit the like and subscribe button. We're going to take a quick break and we'll be back in just a second. Okay, so one of the other options that we want to talk about in terms of pain relief, particularly in regards to YouTube channels, is the following. So Bob and Brad, which are therapists that are present in, I want to say Minnesota, I believe, and they have a pretty interesting channel that looks at different treatment options, much how Dr. Joe does getting rid of knots and quick pain relief. They provide different exercises and other options that make sense for having some degree of improvement for painful type conditions. So any of those resources may be of use for you to figure out how to be able to improve your pain, how to be able to deal with your specific condition, and how to feel potentially better. One of the other options that's out there is Yoga with Adriene. And so she does different yoga poses, not all of which are restorative in nature. So as I was saying, her channel shows different poses that may be able to help improve your overall pain. She has a focus also on how to be able to use your breath for how to improve pain, and also yoga for beginners, all of which can provide some degree of value. One of the other resources that's out there is drugs.com. And although I know that sounds pretty intimidating, it's like, I'm not sure I want to go to a site like that. If you hear me out for just a second, I'm sure that you'll find some value to it. And so one of the things that you really want to understand is the following. So drugs.com is a site that allows for you to be able to take a look at what's going on with the medication, what are the potential challenges with side effects, how does it interact with other medications, and really what value might it provide to you, particularly in the context of everything else that you're doing in terms of trying to be able to treat and improve your overall pain. So it also has a pill identifier. So just kind of showing you what that looks like. It looks like the following. So there are different elements where you can be able to take a look and see, and you have to obviously go through this agreement and accept all that. But once you have accepted all that, it'll show you different ways to be able to evaluate what the pill is, what it can do, how there may be value that allows for you to be able to understand what's going on based on the color, the shape, and all those type of things, which is incredibly useful. So one of the other treatment options that's out there is something that's called Medgadget, pardon me. And so it is one of the most useful sites for being able to understand how and what makes something tick, with understanding the new nature of treatment options for like that are out there for being able to provide value with new treatments that are there. So, for instance, as you can kind of see as the site finally comes through, monitoring different cognitive performances using smart devices, fully implantable devices, different ways of being able to do imaging, electrical stimulation for function post spinal cord injury. So, if you're looking for new age treatment options and things that can really be able to provide value, not only for pain, but also for other treatments, this site that is Med Gadget is one of the most interesting, useful sites on what is out there in the horizon so you can understand what can be provided to you that can be valuable and can be useful. So as we go to some of the other sites that really we think make a lot of sense for you to be able to look into, one of those sites includes something that's called Medscape, which is a site that lets you be able to figure out and look for different resources that are a little bit more digestible than what you might normally get when you take a look at sites like Pubmed, which are initially going to give you all research articles that sometimes can be a bit challenging to be able to figure out. So when you go to something like Medscape, which I'm going to show you in just a second, it actually will give you easy blog type articles that can help you understand different treatments like, let's pick obesity pegged as diabetes cause. Now, we could be able to look this up and make it specific for pain, but it will basically give you articles in the same way as what you might read them within the context of a regular newspaper. So that way you can have an understanding about what exactly is the potential value to you and how that then can be useful and you can apply it almost immediately. So the different sites that were given to you, I know are numerous. I know that it's a lot that's kind of coming to you, but one of the things that we wanted to do is to give you the ability to be able to have a number of different resources, maybe find one or two that's going to be a good fit for you. And then you can be able to leverage that to say, hey, this is my go-to to learn a little bit more about how I can feel better. And so I'm not just going to be reliant on what someone tells me, but also something that I can be able to research and learn on my own. So one of the other sites that we really feel is incredibly valuable for particularly for patients that have pain is the following, and that's the National Alliance of Mental Illness. So let me be absolutely clear. I'm not saying our pain patients have mental illness. What I'm saying is that pain can certainly cause a number of different impacts on one's mental health. If you are not able to function and do the things that you'd like to be able to do, it can make you depressed. It can make you anxious. It can certainly influence you on a multitude of levels. And really being able to understand that and not just being stoic and saying, you know what, I can be able to tough it through. It's not going to give you the best, most comprehensive treatment methodology of being able to improve your underlying problem. You got to know, how is this affecting what you care about and what makes you tick? And you need some strategies at times to really be able to leverage how can you be able to improve those things. And this can talk to you without you feeling like, you know what, I don't really feel like talking to someone about this, but you can get some information about what your mental health impacts in terms of your overall health. And more importantly, how can you be able to improve your mental health by using different strategies that may be of value to you. So one of the other sites that we really want to talk about and cover is that dealing with the areas of headache. And so when we get into the areas of headache, what we really want to know is how and what headaches are presenting and what are the different treatment options that are out there, which are actually pretty numerous and plentiful currently. The treatment options for headache have just exploded as of lately. So some of the things that we weren't able to do before we now are able to do that had been major challenges and issues before. So taking a quick look at the site for headache is pretty simple. It's headaches.org, which will give us the National Headache Foundation. And as you can see, their mission is to cure a headache and to end its pain and suffering. And one of the things that they do is they really target this towards patients. They provide resources and tools that allow for you to be able to see some of the different ways that you can be able to look at publications. You can learn things like webinars. You can get some insight into clinical trials. There are different resources for veterans. There are things that can help you understand what is a migraine? How does that migraine impact you? What could you potentially be able to do differently in order to be able to make all those things possibly better? So the headache community has a huge resource in looking at this particular site that really is of incredible value that can help you be able to punch pain in the face and get back to leading the life that you deserve. And although it's apparently taking forever to come up, it is a pretty robust site with a lot of information that's in place. And skipping to our last site, and that would be our own personal cutting edge integrative pain centers. And as you know, we have a newsletter that allows for you to be able to be informed about different treatment options that are in place. But we also have both blog pieces that talk about different treatment options that are out there. And to be frank with you, I think we do a good blend of both basic information as well as really super specific topics that make sense, that will help you understand the progression of science and how to really be able to say, you know what, I can get a handle on this. I can understand these things better. And so when it comes back around to the end of the day, is really us being able to provide a resource laden treatment option plan for you being able to say, you know what, I need to know more about why I hurt, how it actually is causing me problems, how it's affecting my mood and my lifestyle, and what can I do in order to be able to treat it than just the three options that I've been presented. If this is of value to you, please go to our YouTube channel, sign up and subscribe, hit the like button for this video, recommend it to some people that you think might find this of value, and tune in to our weekly show, as well as some of the other videos that we put out that help you punch pain in the face and get back to leading the life that you deserve. Thank you so much for joining us. Have a great day.